Well, I want to start off by just saying what an honor it is to be here and to see the work that's being done and to think of how we're all going to go forward together. Let me get my back up here. So what I want you to do is just virtually or actually close your eyes and think of a time when you were doing your work in an environment, in a culture that you felt was supportive of you, and that you were supportive of each other, and that the mission that you were there for was really front and center in everybody's mind, and where everyone's attitude was, let's help each other do the work that we're meant to do. I think we acknowledge how wonderful it is to be in that kind of work environment, where it's respectful and where especially there's a high degree of relational trust. On the other hand, well, and I guess the moment is to say now that we can't help but know what a positive impact that has on our sense of well-being. But what we don't see much of is looking at this in the framework of well-being. It's often not queried in surveys, and it's very rarely attended to in interventions. So we decided at our hospital that we wanted to mindfully, explicitly, intensely, and robustly work on the culture of our institution, because we feel it has such a huge impact on how we do the work that we do, and therefore on the outcomes of the work that we do. So we started this center, and I'm going to tell you about just a couple programs in the center. Brigham Women's Hospital is one of the Harvard teaching hospitals. We're an academic medical center. What's most important is for me to honor all the people at my hospital, and also a lot of the people in this room who've really been so helpful in thinking about doing this work and moving it forward. I particularly want to shout out to the two women from the Employee Assistance Program with whom I partner really closely in this work. So this is an overview of some of our programs. I'm going to focus on the two of them to start out with the Professionalism Initiative. We figured that this culture of relational trust that we wanted to create and support was going to be predicated on a high level of professionalism. So defining professionalism, it's any behaviors that support trustworthy relationships. If we're going to talk about professionalism, and furthermore, if we're going to actually affect an organizational culture change, we have to confront the dark side. And that is that all too frequently, across disciplines, we have behaviors that are not professional, where either the patients aren't treated professionally, but also those other members of the healthcare team are not treated professionally, respectfully, and with value. If you're going to build a program, you really have to think about that. So what we did was we got leadership commitment. Lots of the arguments here today were the arguments that I used back in 2008 when we started the center, and that is that this matters only if we care about the outcomes of our work, whether it's research, education, or clinical care. If we care about those outcomes, then we have to care about this. So we got the leadership commitment, and then we also realized you can't just tell people how to behave. I mean, I'd like to. I'm a surgeon. I really like being in charge, and if that would work, I would totally do it. But it just doesn't work, because people behave in ways that works for them in the environment they're in. So you need to tell people, first of all, we've changed the expectations of what your behavior should be. And also, we're going to help teach you how to manage your behavior even under conditions of stress, like conflict management, teamwork, communication skills. So we do a lot of education. And very importantly, in parallel, you have to have an accountability program. Everyone has to know that we treat everybody the same. That is, we have the same level of expectation for professional behavior and respect that we do for the high rollers as well as people who are lower, if you will, on the hierarchy. The accountability program is very challenging, but I think foundational to this culture change that we're working on affecting. And some of the principles are basically, we're very careful to protect the people who come and express concerns, that is prevention of retaliation. We are also respectful of the people about whom the concerns are raised, because not all of the concerns are valid. We need to investigate them, assess them, and we use a very robust feedback mechanism. And interventions to give people a chance to hear how they're behaving and how it's impacting others, and a chance to remediate. We monitor, and then we have an escalating accountability for those who have found themselves unable to change their behavior. We've published some of our outcomes. This is not from the paper, although it's from some of the data. But if I do say so ourselves, we have some really good outcomes. People who we just thought would never change their behavior were able to with our interventions. And as you can see, a significant proportion of the clinicians about whom concerns were raised actually changed their behaviors. I want to pivot to the peer support program. In medicine, every single one of us has faced some major challenge in our careers, one that has had the potential to take a huge emotional toll. And personally, I can't think of any more intense than when we've inadvertently caused harm to a patient. Absolutely a devastating moment in our careers. There's a lot of data on this. We've done some studies on it, but plenty of other people have, and many people here today have already presented this. This is a very intense inflection point in anyone's career. There's often sadness, shame. We're supposed to be perfect and we're not. Fear, anger, and awful sense of I'm alone. I'm alone and I'm unworthy. And that being alone, that isolation, causes severe acute and chronic stress. So we wanted to figure out, what can we do? We reason that if we aren't there for each other at these moments, then everything else we do towards wellness and culture change is really just minimal. We have to be there at the toughest moments. So how to do that was based on some evidence base, some studies we did. For example, we looked at we asked physicians, lots of questions, but in particular, if you were involved in if you had made an error, where would you want to get support? And even though we have phenomenal services, as someone pointed out, physicians were not really keen on accessing the mental health practitioner services. They want to talk to colleagues. And we found this true of other disciplines as well. People want to talk to colleagues who've been there, who know what this feels like. Another study I was involved in, we looked at what factors would be positively correlated with resilience after errors, and talking about it with colleagues was certainly a big factor. So based on this and our own experience, and also looking at the first responders who have very vigorous peer support, we developed a peer support program that has both a team-based group peer support offer. If a team has been affected, an ICU team, even an ambulatory care team, an emergency medicine team, they are offered a peer support group facilitated, where people can talk about their emotions and how they're processing this. There are many other instances that needs to be layered on top of or with one-on-one peer support. And I think the most important thing about our program, and we learn from experience, is we cannot sit and wait for clinicians to come and tell us they're hurting. We have to reach out to them and say, we heard you were involved in an event. I'm here as a colleague, I've been there, and I want to help in any way I can. How are you, and what can I do to help you? And it's that reach out, that proactive being there, we're here for you, that says we care about you, and if you're suffering, it's because you care, it's not because you're weak. We offer peer support for lots of other things, adverse events without errors, being reported to the board, being involved in a malpractice suit, death of a beloved patient. Just, a sad thing to see. Chronic stress, we get a lot of support for transition to our electronic health record. Caring for trauma victims after the Boston Marathon bombing, global crisis relief work, and we had the terrible experience of having one of our colleagues shot to death by a patient in the hospital 2 years ago. And we provided a lot of group peer support and one-on-one peer support as well. We think that one of the benefits, in addition to the individual support that's given and team support, is a huge cultural statement, a shift in culture. That is, you didn't make this mistake because you're a bad nurse or a bad doctor or a bad person. You made it because you're human. It doesn't mean you're not accountable. It doesn't mean it doesn't have a horrible impact on the patient, but it's not because you're a bad person. This expectation that you're not supposed to feel something when you've taken care of a patient who you care about, and you see the patient die, even if the care was perfect, it can still hurt. It normalizes reactions that we can have to the stressors that we see. And I think the biggest one is going from this idea that I was absolutely drilled into my surgical training, which is self-care is selfish. In fact, self-care is critical, because you can't give what you don't have. A quote from Meg Gaines, one of the wonderful patient advocates I work with. If we want people to show up to do the work that we are meant to do, they have to be whole. They have to be cared for. We've had the honor of being able to work with multiple other institutions to develop programs like this that suit their own microcultures, if you will. But what strikes me is a similarity across all sorts of institutions, specialties, disciplines, both in our country and internationally. This is a quote from Parker Palmer, who I just love, and he talks about institutions as being where the human heart either gets welcomed or thwarted or broken. And I think that we're in the business here of welcoming the human heart. And I'm really, really honored to be part of that with you. I want to leave you, if I could, with just a poem, because I think it says so much about this, the need that we have. It's called Shoulders by Naomi Shihab Nye. A man crosses the street in rain, stepping gently, looking 2 times north and south because his son is asleep on his shoulder. No car must splash him. No car drive too near to his shadow. This man carries the world's most sensitive cargo, but he's not marked. Nowhere does his jacket say, fragile, handle with care. His ear fills up with breathing. He hears the hum of a boy's dream deep inside him. We're not going to be able to live in this world if we're not willing to do what he's doing with one another. The road will only be wide. The rain will never stop falling. Thank you.